This morning, we're talking LASIK surgery, the benefits, results, and tackling a lot of questions many people have. Today, we're joined by Dr. Lee Wiley, an ophthalmologist and LASIK surgeon in Pineville and Still Creek. So let's start with the basics, doctor. What is LASIK eye surgery?
So a LASIK eye surgery is basically when we resculpt the cornea with a laser to help apply the patient's glasses prescription to their own eyes, to help them see independently without glasses or contacts.
So how is that performed?
Well, there's multiple ways to perform LASIK or a laser vision correction. LASIK itself, we perform with two separate lasers. The first laser makes a very precise flap that's partial thickness of the cornea itself. I raise the flap as the surgeon, and then a second laser applies the treatment to the corneal surface underneath that flap to resculpt it to help the patient see better. Then after that portion is done, I put the flap back down and the patient heals up very rapidly.
Can anyone receive LASIK?
That's a great question. So there is a certain criteria when we're signing up LASIK patients and assessing for candidacy. Our number one thing is we want it to be safe. And so in order to do that, we do a pre-screening visit to make sure their cornea has enough thickness so that we can sculpt enough of it in a safe manner. But if you're out there watching this and you look at your glasses prescription, we generally, for a nearsighted patient, I'll do up to about a -8. For a far-sighted patient, I'll do about up to a +3, and it can correct up to about +3 units of astigmatism as well. It's great for astigmatism. So there are criteria, part of which I've just discussed, but we do assess that prior to going into it so that we know your procedure will be successful if we're going to do it.
So how long do the results last?
The results can be considered permanent, and that's very important to know. Okay. Now, sometimes many years down the road, there is a little bit of drift away from that permanent result. However, that can be treated with an enhancement if needed, but consider the results permanent. They're very, very stable.
So what should someone do before coming in for LASIK surgery evaluation?
Before coming in for a LASIK surgery evaluation, I would highly recommend staying out of your contact lenses for at least 2 weeks. That way, all of our preoperative measurements and assessments are accurate, because the contact lens wear shortly before that appointment can sometimes interfere with our results.
And where can people go for more information, Doc?
For more information on LASIK, you can go to our website, www.CEENTA.com, and you can actually set up a LASIK evaluation appointment right online.
Dr. Wiley, thank you very, very much, sir.
Thanks for having me.